You didn't ask for this, and it has somehow set your physiological state where things will affect you on a stronger level. I'm not saying that you are imagining your physical pain. I'm just saying your thermostat is set differently. You're going to be more sensitive to anything that happens to you.
And I think there's a lot of evidence in the medical literature when it comes to adverse experiences early on and pain. There are a lot of centralized pain syndromes that are highly correlated with traumatic pasts in particular. And so oftentimes I think as physicians we're not as attuned to the mind. It's just not as well taught in our world.
And it's scary.
And
who wants to hear about it?
Who wants to hear about it? And it's we might not have the time. Sometimes we just don't want to go there because it's a lot to bear even for the physician.
And that's why send them to Laura.
Yeah, send them to our psychologist. But really, when it boils down to the actual nuts and bolts of the science, it's all interlinked. We often see sometimes when we have patients that have a multitude of not only just pain but other medical illnesses that they tightly link with oftentimes with a traumatic past, because we know now after some powerful studies by Kaiser Permanente and the CDC years ago that adverse experiences early on in life not only change the brain and the nervous system, but it can change the immune function and a lot of health outcomes later on in life.
Well, look, common sense. Children are forming. So as your immune system, as your nervous system is forming, when you're going to have the most damage from abuse, it's going to be when they're little.
Yeah.
And they also then sometimes, not that they look to be hurt, but they learn that they're powerless. So that somebody who has been a victim of abuse in childhood, their mindset maybe become, I can't do anything to help myself. Because they've learned that. Right. Just like you learn whether you've got
a learned helplessness.
That's very well documented.
Right.
So to help them find their own personal power and do what they can do.
Right.
Not be unrealistic at all, but it's very, very prevalent. And I went to a seminar, and this woman was talking about childhood trauma.
Right.
And she says, we don't have an opioid epidemic.
Right.
We have a trauma epidemic that people are using opioids to medicate.
Right. And I think that's one of the most important lessons that I think we've learned when we've looked at substance abuse in our area, and which is a huge prevailing problem. But I don't think the prevalence has really changed all that much. It's the drugs that change.
Right.
And there's so we have gone from, even in my time, a prescription drug epidemic, and when the amount of prescribed drugs decreased in this area, we had a change to an illicit opioid or a street opioids from heroin and fentanyl. And also we're seeing an increase in methamphetamine and other drugs altogether. And the same people might be taking multiple drugs who are experiencing it's polysubstance abuse, as we call it. And it's not so much, I don't believe, a particular drug that's an issue. It's the drugs that are available to mask oftentimes trauma that has been experienced.
They're medicating. They're self-medicating their pain.
Self-soothing in a lot of ways.
And what's been nice in the addiction community is that when the 12 steps first came out, it was just sobriety. That's all you had to do. But now they're adding to that approach that not only do you have to abstain, but that you have to look at what issue may be driving. Now, understandably, there's a physiological difference in an addict and a non-addict. A lot of people drink,
right,
and they're not
an addict.
They're not an alcoholic.
Compulsive drinker, yeah.
But you get them sober, and then you got to look at what they're medicating.
Right.
And it's a dual hit model. And you're right.
So there's a tight link between addiction and trauma, but also pain. So not everybody who has had trauma will experience pain, and not everybody who has pain has had trauma in their lives.
Exactly.
But we know that that pain changes the brain. You had someone who had the hypersensitive kind of central nervous system as a result of potentially a traumatic past. It's almost an exacerbation of the pain. So what can a person do under those circumstances? You hurt all the time.
Get into therapy. Get into therapy. That's what I tell them.
Yeah. And so encouraging that along can help outcomes. How so? How do you think that may help?
Well, I think can we save that for another session?
we can, absolutely. Maybe that will be part 2 for
it's a big issue.
Yeah.
I'll be happy to talk some more.
This is just scratching the surface when it comes to adverse childhood experiences. We can go on and on, talk about this a lot. But we just want to give you a taste of it, and maybe we can expound upon it a little bit more.
I'll be here.